Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the basics of migraines. Migraine is a chronic headache that affects people from a few hours up to 72 hours straight. It's a complicated, recurrent headache disorder. It's most common in women and those between the ages of 15 and 55. Most become less severe and less frequent with age. Migraines affect 18% of women and 8% of men. 30 million in the U.S. have at least one migraine per year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% have a first-degree relative who suffers. If one parent suffers from migraines, there's a 40% chance the child will suffer. If both parents suffer, there's a 90% chance. Over 90% of sufferers are unable to work or function normally during their migraine headaches. There's a lot we don't know about what causes migraine headaches. Genetics, environment, we know are involved. We do know there's imbalances in brain chemicals, specifically serotonin levels drop during migraines. Low serotonin levels can trigger a migraine by letting too much blood flow through vessels that should be constricted, and that induces a throbbing sensation and the migraine. There are quite a few typical migraine triggers. Various foods such as aged cheese, red wine, beer, whiskey, food additives, cold foods, citrus fruits, MSG, and caffeine. Elevated stress can do it. Barometric pressure changes, strong scents such as perfume and paint, hair accessories, and exercise. A few more: poor posture, skipping meals, and smoking. One small silver lining is that there is no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. So that's a myth, thank God. Now, symptoms. Often people have a unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or sensory symptoms prior to the onset of the headache, which can include photophobia or visual scintillations. 80% of migraines are not predicated with an aura. There is no objective testing available to diagnose migraines. Doctors will often get a CT or an MRI scan to rule out badness like a tumor that could be causing similar symptoms. It's diagnosed on patient history and a pattern of symptoms. A migraine diary can be extremely helpful to the physician. Now, the International Headache Society requires patients to have at least 5 attacks fulfilling 3 criteria. One is 4 to 72 hour duration, and at least 2 of these: unilateral, pulsating, moderate to severe pain, aggravation by or causing avoidance of routine physical activities, and then 1 of these: nausea and or vomiting, photophobia, and or phonophobia. When it comes to abortive treatment options, meaning you have a migraine and you want to abort it, get out of it, get pain relief, there are various medications such as triptans, which target serotonin levels. There are quite a few under the triptan family: amitriptan, elatriptan, provatriptan, naratriptan, rizatriptan, and then sumatriptan, which is the most common, and zolmitriptan. There's more. There's nasal sprays such as Migraine, Migrainol, Cafrago. There are over-the-counter medications put out by each of the major pain relievers such as Advil Migraine, Excedrin Migraine, and Motrin Migraine. Narcotics are commonly prescribed as an abortive option, barbiturates as well. Nausea medications can be very helpful, such as Reglan, Compazine, and Phenergan. Preventive treatment options have the goal to lessen the frequency and severity of migraines. Some of these are used off-label, such as high blood pressure medications, beta blockers, calcium channel blockers, antidepressants such as Elavil and Pamelor, anti-seizure medications including gabapentin, Topamax, and Depakote, and then serotonin antagonists such as Sonomagran. Interventional treatments. The FDA has approved Botox injections for chronic migraines. They're given at 3-month intervals. It's a 10-minute procedure that involves 32 injections. It is covered if certain medications have been tried and failed. What they state is it's for chronic migraines. Distinct and severe neurologic disorder are characterized by patients who have a history of migraine and suffer from headaches on 15 or more days per month, with headaches lasting 4 hours a day or longer. There was a very large study where patients treated with Botox averaged 8 to 9 fewer headache days per month compared to baseline, as demonstrated in the PREEMPT study. That's the study that the FDA based the approval on. Interventional treatments, there are quite a few outside of Botox, which can include occipital nerve blocks for cervical facet injections, cervical epidurals, phenopalatine ganglion blocks, supratrochlear blocks, supra or infraorbital nerve blocks, and then pulse radiofrequency ablation of the occipital nerves. Now here's some outcomes. Study of 100 patients receiving greater occipital nerve blocks, 53% achieved pain relief averaging 3 weeks. Here's another study, a retrospective one, looking at greater occipital nerve block for refractory migraines. They used a mixture of lidocaine and steroid for the nerve block. 54% of migraine patients reported on being significantly better after the blocks, and the duration of response lasted up to 6 months. So you're seeing a consistency, right? 53%, now 54%. Here's another one looking at the benefit of peripheral nerve blocks in the treatment of migraines. They looked at 27 patients before and after greater occipital and supraorbital blocks. They gave a maximum of 10 injections with 85% effectiveness rate for 6 months. The top non-operative pain relief in Georgia is through the Georgia Pain Network. There are several clinics throughout the state, all treating migraines with all of these options. Over 50 insurances are accepted. Over 25 treatment options are provided with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.